The goal We are being recorded, so welcome again. The goal of our Foundations of Global Health, it is designed to connect residents, students, learners, and faculty to leaders in global health. This series is created to support the development of global health professionals, giving participants inspiration, as well as shaping attitudes around global health, so that we at KUMC are trendsetters to move beyond the us versus them and have nots mentality to a platform of equality and mutualism, which garners true collaboration and global health exchange for everyone's equal benefit. The goal of this series is to inform participants about the field of global health in its entirety, to include global health research, philosophy, approaches, attitudes, and the various efforts in the areas of global health disparities, health inequalities, and community health. And before I move on, I wanted to also bring your attention to our interpreters that we have this evening, our ASL interpreters. We have Chris Brooks, who is with us this evening. So thank you for being here. Upcoming events in our Foundations of Global Health series include one coming up just next week on Monday, January 25th by Dr. Nathan Barr. He will present on ID Global Health Research. We also have another one set for Monday, February 8th at 12 p.m. That will be with Dr. Halsey, and he will give a presentation called An Insider Secret to Starting a Career in Global Health. And then we also have another presentation on Monday, February 22nd at 1 p.m. with Dr. Lawson, as well as Dr. Malfatti will join us and give us a presentation on cross-cultural relations. That will be on Tuesday, March 10th at 12 p.m. And I am very excited to have with us again this evening, Dr. Méndez. Dr. Francisco Méndez is a rural Mayan doctor working in the highlands of Guatemala, providing primary health care, health education, as well as hospital services. He holds a master's in public health from the Universidad Rafael Landivar, and I'm sure I mispronounced that here, so forgive me, from Guatemala City in Guatemala. And he also has a doctorate in medicine from the Universidad in San Carlos in Guatemala City, Guatemala. Dr. Méndez is the medical director at the hospital in San Pedro in Guatemala and is also responsible for the management and administration of a 10-bed hospital there. He trains locals and international students and volunteers in healthcare, in health education and intercultural activities. And since 2018, Dr. Méndez's clinic at the hospital in San Pedro has been the clinical site for the University of Kansas Medical Center International Outreach, our KUM-CIO groups, first and second year medical students. So without further ado, I welcome you, Dr. Méndez.
Thank you. I wanted to split the presentation in two parts. The first one, I want to try to explain a little bit the context where we are working and how we start working in the rural area of Guatemala. So, and then the second part, it's about to explain a normal day. I mean, during this virus outbreak, the normal day it's changing a little bit. So we have to do some changes in our schedule, trying to deal in the middle of this pandemic. More than 25 years ago, we start with a very small clinic in the rural area of Guatemala, providing medical care only once a month. When I get my medical degree, I was working in Guatemala City. Usually, it's very common that in Guatemala, most of the doctors stay in big cities. I think probably it's the same in the US. But during this process, I realized that it's more need in the rural area. So when I start my professional life, I was working in the city, but little by little, I was moving to the rural area. So at the point that now I just go at least once a week to Guatemala City. So I spend mostly of the time in the rural area. So when I get my medical degree and I start working in the rural area, we was working just two doctors in this community, and just myself speak the local dialect. Now we have more doctors, at least more than 10 doctors in the community, and some of them already speak the local dialect. But at the beginning, I was the only one speaking the dialect. The name of the dialect is Sutuil. And around the lake, we speak three different dialects in the area where the hospital is. During that, the last 25 years, we have been, if you can just pass the next slide, please. There we go. So the next one. Perfect. So we just finished that, and then the next one. Perfect. So during that time, we under different conditions, and it's basically affecting our work in different ways. One of the most important thing that I try to explain to our visitors or to our students is that the area where we are working is it's the 90% of the population. It's in a level of poverty, and then that makes a big difference how we work in the hospital. And less than 20% of the population have a social security. Mostly of the time in Guatemala, the health system is covered by the same population. We don't have access in the rural area to private life insurance or social security. It's not accessible for most of the population. Guatemala is the second country in Latin America with the highest level of maternal and neonatal mortality. Probably Haiti, it's the first one, and then the second it's Guatemala. So that makes a huge difference also how we are working in this rural area. Guatemala, it's affected by different kind of natural disaster. We have in this moment 3 active volcanoes that are very close to the area. We have the area, it's affected by earthquakes, and the last 10 years was affected for 2 natural disasters. Was a mudslide, and one specifically 6 years ago affected the area of the hospital. before we start with the construction of the hospital, one mudslide affected the property. So we are in the area where was affected for a mudslide. And now, for obvious reason, many of you have been involved watching what's it's affecting the virus outbreak. Uh, so we are in the middle of this pandemic, and if you can imagine working with the level of poverty, with the level of maternal and neonatal mortality rate, so and with limited resource normally working in the area and now affected by the virus outbreak. So it's uh, a big impact, and it's mostly for the families affected now for the virus. It's catastrophic for their economy and the life conditions. So the next slide, it's I'm trying to show how looks 25 years ago, the small clinic where we start working, providing medical care. It's on the left side. And just 5 years ago, we start building a 10-bed hospital. And now we finished with the first phase, which include an operation room, an emergency, and some patients' room than we have in this moment. So this is a huge change and a huge impact in the community. Mostly of the members of the community have a lot of expectation of this. My colleagues coming to work here in this small hospital, they say that it's probably the one of the most efficient facility around the lake. So that makes us feel very proud and years. So in the next slide, the next one. There we go. So basically, a normal day now affected by the virus outbreak start 7 a.m. So the property where the hospital is, it's it's a lakefront hospital. So I try to have a morning walk at the beach every morning. We start with patients at 8 o'clock in the morning. When we have patients in the hospital, like after patients after surgery, so we have early rounds 6 a.m. Before checkups with regular patients, and then from 8 to noon, from Monday to Friday, we check patients, and we decided to work just in the morning when the virus, the coronavirus, start last year. So and then when we have patients for any reason overnight, so we try to have check out for those patients 11 o'clock every morning. So we discharge patients, write prescription, and try to organize the appointments for those patients. So lunch is at noon. one important thing here in the rural area of Guatemala, then and probably it's different than in the US, people don't have the culture to do appointment. Most of the patients just show up every day. So, but we are trying to change this because we try to educate the population, then it's more convenient for us and for patients to do appointments. But most of the pain, they just show up, but we are trying to work just in the morning, and then in the afternoon, we try to do some home visits in some other communities around the lake. We try to do some educational activities in the local market, like take blood pressure screening or blood sugar screening also. And the hospital, it's open 24 hours a day, and regularly. The main reasons for people to visit us, it's detailed in the next slide. We uh, in the young population, we have very common respiratory infection, vomiting and diarrhea, and skin allergies. That's the most common reason for us to see patients here. Uh, eh, in the women population, obstetric emergencies is very common. Pregnancy, we have an average in this community of 5 kids for age women. So pregnancy is one of the main reasons for women to come to this hospital. Gynecological problems, abdominal pain, it's very common also for different reasons. And then in 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 female or male adults, unfortunately, it's increasing the chronic disease. In the next slide, it's a little bit hard to explain how a poor country like Guatemala, in the last 20 years, it's changing the reason for people to visit a clinic. Because when I start my career, the most common reasons in general was respiratory infection, diarrhea disease, or skin allergies. But now in adults, it's getting worse every year. Chronic diseases like diabetes, hypertension, and cancer. So, and this is a enormous difference in how we have to focus our resources in the hospital, and also how we deal with the health education with the population. So, and with the virus outbreak, we have been seeing since start the pandemic at least 3 or 4 patients every week with COVID symptoms. And now it's increasing again here in the rural area. Just a week ago, one of our doctor working here in this hospital get infected by COVID, and now he is in intensive care. Thanks God he's stable, but I mean, that's a good example. Then in Guatemala, affected really bad. The next slide, I just explain a little bit about how have been changing the way how we are providing the medical care in this community. At the beginning, mostly of the medical care was provided by myself, but now in the last 4 years, I, we have the support of more doctors, locals and international. In this picture, you see two of the pediatrician, I think coming from Children's Mercy from Kansas. So they were a very good support for this community because we don't have pediatricians here in where is located the hospital. The next picture is Dr. Kennedy and some of his students. And also we learned that we have to share our knowledge with new or future professionals, with with students, with young students. It's very, very important how we can keep providing medical care in this community. And it's have been in the last couple of years a huge support for us, having this connection with Kansas University, providing students and professionals to not just to learn how we are working here, but also providing medical care to our community. In the next slide, it's the operation room than we have here. So it's the first operation room of at least two that we have in the plans in the future. And probably it's the area where I spend a lot of my time, usually during a day, because every year it's increasing the patients who are asking for medical care here. And for some reason, during this pandemic, increased more than 100% of procedures in our operation room, because one reason probably it's because some people decided not to go to a hospital in the city for the risk of getting the virus. So we think that that's one of the reasons that we increase more than 100% of procedures in our operation room. So OBGYN, it's one of the main activities that we are doing. In the next slide, so it's one C-section. So C-section, it's very, very common. We are having at least one C-section every week here. The next one, it's we start 2 months ago providing the traumatologist service. So we have one traumatologist that is coming at least once a month to do some procedures. In this picture, we are showing the fixing a bone in the shoulder. This person was having a tuk-tuk accident. Those people who don't know what mean tuk-tuk is a kind of the main way of transportation here in the communities are small vehicles like a golf car. So, but it's not very safe. So we have a lot of accidents of those. The next picture, it's a picture of hernia repair. General surgery, it's very common here. When we start a couple years ago, we have been performed like hernia repair, appendectomies, gallbladder stone remove. Basically, all the procedures that we do in this hospital. And the next slide, it's like I really enjoy what I am doing here. I try to make a balance between all the work that we have to do in the hospital with my family. In the same property lives my parents, my wife, and my older son, and these two grandkids. And then so we always find the time to share with them. So we feel that we are very blessed because I mean we are in front of a beautiful lake. So sometimes then I am in like in a permanent vacation because in 1 minute I can be in the operation room, and then just the next 5 minutes I can be just resting in front of the lake. So I feel very blessed to have this opportunity. And the last slide, it's also we always find the time to drink a good coffee. That is a souvenir from our students from Kansas. Guatemala has one of the most delicious coffee in the world. So that's I'm addicted to drink coffee. So I always find the time to drink a cup of coffee during the day. So it's basically how a normal day it's for me. If you have any question or comments, or especially if some of the people that already know want to add something or want to ask something, I'm so happy to start the conversation.
Hey, I'll have you know that was my brother. See, I have more hair than he does. No, I would, just the very short, week-long periods of time that I've been with you, I don't know how you maintain the schedule and how you are available day in, day out, 24 hours a day. So I commend you for that.
Yeah, with I mean, it's I try to keep a balance. I know that sometimes members of my family ask to me to rest a little bit more than I do. But the thing is, I can feel also that I am getting old. I can't work with the same energy as I started many years ago, because at the beginning when I was working in Guatemala City, I try to come here at least once a month to work, and then drive 4 hours to to go back to the city and just keep working. But now I can't do that, so that's the reason that I spend more time here. But also I can see that people in a big city has more options to see a doctor, but in the rural area, I mean, sometimes when people call in the city call me, then they need some like emergency care, and I say them I'm not in the city, so they just go with the next doctor. But when people from the rural area call me and say we have an emergency, so and I say I'm not in San Pedro now, so just they say okay, we are going to wait you. So sometimes people spend one day with abdominal pain waiting for me to come back to San Pedro. So that's kind of thing that touch my heart and make me keep working and stay here. So, but little by little it's changing. So we have in the community new very young doctors, and I am trying to involve them in this project, and we are getting success with this. So more local doctors are coming to help us in the hospital, and I think in the close future we will have more doctors than just me working here. I hope so.
Are there any questions from our participants? Please feel free to unmute yourself and ask away.
Hey, Dr. Mendez, great to see you again.
Hey,
I had a
hello.
question for you.
Yeah.
So I know culturally sometimes with modern medicine, there are some misunderstandings, or it takes time for you to educate people in a like culturally sensitive way on modern medication. How has that gone with the coronavirus and the importance of masking and social distancing and altogether like that public health side of this?
Oh yeah, that's a good question. Here we have a mix of different behaviors about the coronavirus. We have some people who think that this kind of disease doesn't exist. It's something that it's a kind of a business of huge companies trying to sell now their vaccines or those kind of things. So, but the elderly population are more easy to explain them because they already had the experience in the past of some pandemics, like we have in the past many kids who pass away when we have a sarampion. It's, I think, chickenpox. No, measles. We have many years ago an outbreak of measles, sarampion, in the community. Those was many kids was affected for measles.
Yes. Sarampion is measles. Sorry, just wanted to clarify. It is measles.
Thank you, Carlos.
It's sarampion.
Yes, it's measles or rubiola. Yep.
Yeah. So we have many years ago, and then a lot of kids just pass away, and then so all elderly population they understand then it's true. So we actually, one of the theory of then mostly of our ancestors passed away was because they was affected for some kind of a disease. But yeah, there is a lot of misunderstanding. But San Pedro, I think San Pedro, it's a little bit different than other communities around the lake. San Pedro, some families try to invest more in education, but we have other communities like San Pablo. San Pablo, it's one of the poorest community in Guatemala. Probably it's the second poorest community in Guatemala. And when you go to San Paulo, that's a community that nobody use a face mask. They just keep doing exactly what they do before the virus outbreak. And they say, no, that kind of disease doesn't exist. We believe in God. And if God decides and we are going to die, so we will die. So they beliefs are very, very strong. San Pedro is not too bad. I think we, considering in general the level of education of Guatemala, San Pedro is a little bit highest. But yeah, we not just for the coronavirus, but in general for the health education, it's very, very bad. I think one of the main reasons that people was taken seriously this disease, it's because many members of the community was affected. A lot of people just pass away. And then that's the way that people say, oh, looks like it's something serious, so we have to do something. But yeah, that's a good question. The cultural beliefs affect in different ways the way how the virus is affecting our community.
I wonder if it also has something to do with people not being able to see the virus, right? Other natural disasters, for example, you can see or feel like an earthquake or anything else. COVID-19 is nothing that's really visual to the eye. So I just read a really interesting German article on that, the psychology behind it, why some people still, yeah, don't believe in it.
Yeah, that's right. Yeah, that's right.
Are there any other questions?
I have a question. Hi, Dr. Méndez. How are you doing?
I'm doing well. How are you?
Good. Great to see you again. So my question for you is, what have you seen in the local community, so San Pedro specifically? Like, what are schools and businesses and things of that nature? Have they been taking any precautions, COVID precautions? And then if they have, how is that similar or different to what you've seen when you go to like the bigger cities like Quetzaltenango or Guatemala?
Well, San Pedro, it's a touristic area. So when the pandemic started, all the business was closed. All the tourists, the international tourists, they just leave the country. I think at least 95% of the tourism just abandon San Pedro. And considering that most of the population survive here by the tourists, so that was a huge impact. and then all the business closed. Was mandatory to use a face mask, and then also we have curfew, toque de queda, curfew. So that, I think, the all the protocols established by the Ministry of Health and the local municipality was followed for mostly of the population. The market was closed. They was very just specific days and hours to open the market. Yeah, that's it. And in a community like San Pedro and in general in Guatemala, one of the huge impact also was with the Catholic population, because the pandemic start just before the Holy Week, and then all the activities during the Holy Week was canceled. So, and that's, I mean, was a huge impact. And even now, the next Holy Week then will be in, I think, the next couple of months. It's also, we hear then will be canceled, everything also. So, and the difference between big cities like Quetzaltenango or Guatemala City was not too much, because some people was following the news in the TV, and there was nothing than this pandemic and all the protocols was followed, not just in San Pedro but in big cities and all around the world. So it's something that they was saying that it's not just in San Pedro, so we need to keep going and following the protocols of social distance or face mask. Yeah, that's, I mean, I think was not like a big challenge. Try to educate the people to use the face mask and the social distance. But yeah, was affected also for the community for some cultural issues, like we have here like molinos. Molinos are a kind of areas, like a public areas where usually people take the corn to I mean, before to do the tortillas, they have to go to a public place to do
like
the
grind
mix.
it up. Yeah. To
Yes,
grind it up.
exactly. So, but this, to do that, they have to go to a public place. So, and that's a huge difference than in the city. So, and the local municipality have to took some decisions to change a little bit some of those protocols, and tell the people then, okay, each families have a kind of a schedule to go in different hours to take the corn. So yeah, that kind of things was a little bit different, but it's the other thing then affected this virus is that at least 75% of the deaths was elderly people. And there is a lot of concern about the culture, because in a community with then mostly of the culture it's in the wisdom of elderly people, and now I mean some elderly people just pass away. So that means that we are losing mostly of our like our of wisdom. I mean, the knowledge of the culture in the community we lost with the death of the elderly population. Yeah.
Have you had access to the vaccine yet?
No, we are expecting to have the vaccine on March. Yeah. I'm trying to travel to the US to get my own vaccine. Yeah, I think we are expected to have in March. We hope so.
You mentioned a curfew. I was just curious what those curfews hours are, and if it's enforced, if someone is not abiding by the curfew hours, or yeah.
Yeah, at the beginning was from 4 o'clock in the afternoon to 6 a.m. every day. So, and then change to 6 p.m. to 6 a.m. and then change it after to just weekends. Yeah, that's the way. I think. I mean, that's the other thing that uh, was not new for us, because in the 80s we have a history of a civil war, and then a curfew was from 6 p.m. to 6 a.m. every day. We had that, I think, for more than 10 years. So, but that was for the civil war. So for that reason. So some people were saying that, okay, so that kind of things, it's the same than we was living in the past. Um, and some people, I mean, take that, then that's the only way in a country with in general a low education in the population. So it's a kind of a drastic but effective measure to do something against the virus. I think was working in terms of for the medical workers or the health workers. We had the privilege to move from one place to another anytime, because I mean we have to do it for the patients. So we was not in terms of for me to move from San Pedro to Guatemala City actually was more convenient, because we didn't have any traffic in the way. It was, I mean, going to Guatemala City was just like 3 hours. So for the medical staff, in some point was more convenient.
Do people have to pay a fine if they don't abide by those rules? So just for example, in Germany, we currently also have a curfew from 8 p.m. to 5 a.m. in the mornings. And during on December 31st, when people were on the street for New Year, they had to pay a fine, and that was 1,200 euros. So I'm just curious if you have something.
Yeah. People have to pay I think at least 5,000 quetzales, which mean about $600, and spend a night in the jail. Yeah, at jail. To go to the jail. Yeah.
Very interesting. Are there any other questions for for Dr. Mendez. Please feel free to take your mic off mute and ask away.
Have you had any shortages of stuff? We had shortages of toilet paper and kind of ridiculous things. One of the things that my wife and I like to use in cooking is wheat germ, and we haven't been able to find wheat germ on the shelf for months.
Oh yeah, I think here, yeah, toilet paper. What else? At some point in San Pedro, we didn't have a gasoline. Yeah. What else? Yeah. Oh, vegetables. We have excess because was produced locally, but things like coming from the city, like toilet paper or eggs sometimes, but yeah, it's we have from I think the some gas station they just stopped working because they didn't have any gas. So yeah, that was. I think in the rural area, in terms of food, was affecting, but not so bad like in the city, because one of the thing that changed for those people who was working just for in tourism, they have to get back to agriculture, because that was how we survived in many years ago before we start with tourism. So some families have to start growing again corn and beans. So trying to prepare for the future. I think in some way that helped, and the local municipality also provide to some poor families some chickens or some food aid or some fertilizer for agriculture. Yeah, those kind of things.
Are there any other questions? No. Thank you so much for being with us this evening. We very much appreciate it. And yeah, we look forward to having you again soon.
Thank you. I'm so happy to share with you what we are doing here. And thanks for the opportunity again for let me talk with you.
Yeah, very good. And you have very many thank yous in the chat box, so do check those out as well.
Okay, I will.
Thanks, everyone.
Thank you so much, Dr. Mendez. It was a pleasure to see you.
Thank you, Dr. Kennedy. Please say hello to your family.
I will, and to yours as well. And everyone stay safe.
Thank you.